in here.
Okay.
No pain.
Okay.
Yep. So we do that.
I'm gonna trust you on that
Yeah,
one.
we do that. And then we have the deep thermal laser to heal the cell where the damage is as well.
Okay.
Okay.
All
So
right.
that's a herniated disc. Then stenosis, arthritis, and degenerative disc disease are typically 40-year-olds, and I'd say the oldest I've had is probably 96.
Oh.
Typical pain is they're leaning on a grocery cart
Okay.
because they want to get off of the nerve that's back here, so they can't stand up straight.
Okay.
Okay. When they come in here, we get them standing up straight and being able to lean back and then stabilize everything. And then the third thing is a sacroiliac dysfunction, which
Okay.
is SI joint, and it's typically here,
Okay.
and that's typically pain sit to stand, pain rolling over in bed, pain driving in a car.
Gotcha. Now, you also work with some other practitioners around town, and so if you can explain a little bit why you work with, say, certain chiropractors or other type of holistic practitioners, how does that help with your patients?
So chiropractors actually send their patients to us, and we've heard that the techniques that we use give them better outcomes as well. Because
Okay.
we're moving every joint, and the chiropractor is doing a manipulation.
Okay.
We're getting each joint to move. Their manipulations are better and smoother
Okay.
and go more quickly. And because we're stabilizing the joint, the person isn't going out to the car and losing what they gained after they left the chiropractor.
Right. There you go.
Okay? So we work in collaboration with all chiropractors.
Okay.
Okay. I work with Jen Beck for all of our nutrition stuff. So people who can't just go on a diet on their own and lose weight on their own and need a little bit more help, then I refer them out to Jen Beck. Jackie Groenewegen does great massages. She's usually busy. I send people to her for thermography.
Okay.
Sandy's Health Food Store, I send everybody that I know there for anything that they need holistic as far as herbs, supplements, things like that.
Gotcha.
Trying to think where else. We're very holistic oriented. Oh, Teo Float.
Oh, okay.
We send people
The
to
float
Teo
tanks?
Float for the float tanks.
A lot of people don't know about those float tanks.
They're fabulous for chronic pain.
Yeah.
What else do we send people out for? Local personal trainers. We work with local personal trainers to develop a program for people going from our treatment, which is more preventative and holistic, to getting them to personal training so that they can work out. We also get them in local running groups. Anything we can do to get them to the next level so they're achieving personal goals and living a better quality of life.
Okay, great. Well, with some of these, because you got a lot of tables and things here, of course, you could see what they have available. But tell us a little bit about like what these different tables are for, some of the machinery, and you got stretch bands over on this side. You got a running machine. You got all sorts of stuff. You got. I'm assuming you're just throwing those balls around for playtime.
Absolutely, we play a lot in here.
Okay. Okay.
So we do walking consults to show people internally what they need for their shoes, whether they're custom fit orthotics, over the counter, prescriptive orthotics, and shoes that they wear on vacation.
Okay.
This is the inside of the shoe that helps people if they have plantar fasciitis or problems in the knee.
Okay.
Typically when they have knee pain here, then we use these things for that. The beds we use for all of our manual treatments. So we do a lot of manual treatments for necks, shoulders, and upper backs. We also do a lot of low back pain and sciatica. We do ankles for our runners. Getting every joint moving is what we're looking to do. So any joint in the body, if it's not moving correctly, we're the place to come because we're going to work on it manually and then refire the muscles for it to do what it's supposed to do.
Now you showed me something the other day, the
Yep.
cupping.
Yes, we do
Okay.
cupping.
Okay. So could you do like a small demonstration, and I'll try to hold this, and you'll have to roll up my sleeve.
Yeah,
And
absolutely.
okay, cool.
Yeah, we can do some cupping.
So this is pretty cool. What's the other thing that people use in the cupping? They usually like use glass.
Glass and fire.
Glass
We
and
don't
fire.
use glass and fire for ours. We're
Okay.
just using a static or dynamic method to increase nutrition and increase circulation.
Okay.
So cupping actually will take and suction up the skin and the muscle up into the cup. When it does that, then it's taking any damage to the tissue and providing nutrients and increased circulation to the underlying structures so that healing can occur.
Okay.
Okay, so we have dynamic and we have static cupping, both of which are effective for pain.
Non-painful, right?
If there's a pressure with it,
There's a pressure with it. Okay.
but it's really not painful.
Okay.
Typically, we use cupping because it lasts longer than a massage does,
Okay.
and it goes deeper and it's not as painful.
Okay.
So we do have a massage cream that we put on the surface before
Okay.
we do cupping.
Okay.
Okay. And dynamic cupping is just a little cup. It's just a little silicone cup, and you're going to suction up into it. It's going to pull it up into that cup.
Yeah, hopefully they can see that.
I don't know if they
the
can or
skin's
not.
being pulled up. Yep.
Right.
Should be able to see that.
Okay. And then we're just going over to find any restrictions in the soft tissue. So if you have tissue damage, then scar tissue builds up in that area and it doesn't move over the joint surfaces like it's supposed to, and it can cause pain.
Now, I just learned that scar tissue is normal, and everybody has scar tissue like all over their bodies.
Yep.
The areas that they're mainly using, especially if you're typing a lot and.
So the microtraumas that occur during the day, when you're doing a stress on a muscle, then it pulls, and when it pulls, it creates scar tissue, and then it doesn't have the mobility that it's supposed to have. Okay, you can go in there and pull this up and break down that scar tissue so that that muscle is supposed to do what it's supposed to do, so you don't have the aches and pains in the muscles that you're developing over sitting for long periods of time.
Sure. Now, but
So
I
this
also
gets a
was
little
told
red.
that it was Dr. Cody who told me, he's a chiropractor here also in Westchester, but he had mentioned that it's normal to have the scar tissue, but it's when the scar tissue is going the, was it like the opposite direction of the muscles?
Scar tissue forms in many different planes. So that scar tissue or fascial bands, whatever you want to call it, different people call it different things, and there are two separate things. When it forms in different planes and it inhibits the muscle doing what it's supposed to do, which is lengthen and contract and shorten and contract.
Oh, okay.
When it inhibits that, then you have to go in and do something about the scar tissue.
Gotcha.
Usually your indicator is pain in the tissue
Okay.
or tightness in the tissue.
Gotcha.
Okay, different things to alleviate that. Cupping is one. Grafting, where we use tools to get in and actually scrape out the scar tissue too, is another technique that we use.
Okay.
This one, we go in and find the scar tissue cupping, and you see the redness that comes to the skin. That shows there's actually toxins in there, and it's good circulation that you have, but if I feel that there's a problem, then I can go in and leave this on this area and actually pull that through, and it just lifts it up, and you'll get a redness and petechiae that break down, which shows that all of the bad circulation has come.
Okay.
And it will disperse through the lymphatic system, and the deeper underlying areas now good nutrients can come to and heal.
Okay. Gotcha.
Okay. Now that's cupping. Now grafting, you go in and break it down, and you see if histamine is released, and if it's released, then you keep doing it.
Now, how do you know if histamine's being released?
It will be red in the superficial parts of the skin like this is.
So you're saying I have damage?
Well, no, I didn't say, well, you could be damaged.
I'm damaged goods.
But you go in and that particular area and break down the scar tissue, and when you break down scar tissue, you'll see another redness and pinkness in there, which is petechiae, and that breaks down the scar tissue.
Oh.
And immediately you'll feel relief in that soft tissue because you've broken that down.
So what's happening internally? Like, is the blood vessels now opening up, and so it's going there to do its healing? Okay.
It's all about healing. It's all about breaking down the scar tissue that's inhibiting the motion of the muscle.
Okay.
Breaking it down, getting deep superficial blood down there so that healing occurs.
Awesome.
Okay.
So the body's doing all the healing, of course.
The body's doing all the
You're not a guru or anything.
No.
Okay.
This creates sort of a acute inflammatory response, and that ignites the body to actually heal.
Gotcha.
Okay?
Okay.
But yeah, you've got a little redness in there. You've got a little stress in there.
See, I'm getting better. So.
Absolutely.
Anyhow, what else do you got for me?
So we have resistant tubing. We have over here, we have balls, a Pilates machine. We have a unit over here where we do TRX, and mainly we do that to see we're seeing more and more people